Hello, my name is Taylor Clark, and today I'm going to be explaining to you the benefits of expanding Medicaid or TennCare in Tennessee. So to begin, actually, how many of you are aware of the amount of people that do not have insurance in Tennessee? Because honestly, it's pretty crazy. About 6.7% of all Tennesseans go every day uninsured. That equates to about 450,000 people in Tennessee that go day to day not being able to get the care they really need because they cannot afford these premiums and because they do not qualify for TennCare. So expanding TennCare would kind of expand these qualifications for these people to be accessible for TennCare so they can get the care that they need. So to kind of begin, I work with a lot of low-income individuals at my work personally. They tell me a lot of stories of how for them and their children just do not get the care that they truly need because they do not have this insurance. They can't afford it, and of course when they go to the doctor they're charged outrageous amounts that they cannot pay out of pocket, and that's not only bad for them, that's bad for the hospitals as well because they're just racking up these huge bills with these low-income individuals that cannot pay them, and that's not their fault. They just don't have the income to be able to take care of these bills. They just keep racking up, which creates debt and so many other things that is not what our country is really raised upon. So, to begin, like I said, TennCare is a program providing health insurance to people who are eligible for Medicaid, also known as TennCare in Tennessee, and to certain other people who lack access to insurance. And like I said before, I reiterate, about 6.7% of Tennesseans do not have insurance, and that equates to about 450,000 people don't have insurance. So to go over kind of the requirements to be eligible for TennCare, I have a chart listed right here, and this is just the maximum income level these people can have to be eligible. So if they make more than this amount, they are not eligible for TennCare. So for example, you might not be able to see it that well. If you were to have one person in your household, you cannot make more than $16,000, or you are not eligible for TennCare. Same thing for two people, $22,000, or for three people, it'd be $28,000. And if you make over that amount, you are not eligible for TennCare. Now, if you think about that, $28,000 is kind of a small amount. So even if they're making that amount, it's still really not enough to cover large insurance costs that a lot of these insurance companies charge. Let's see. Some other requirements, I'll go back, include you do have to be a resident of the state of Tennessee. And you also, or you could be a U.S. citizen or an authorized alien. You also must either be pregnant, you could be a child under the age of 19, a parent or a relative caretaker of dependent children under the age of 21, or disabled, elderly, or if you're just uninsurable. You must also meet, of course, the financial criteria listed in this chart. So now I'll go into some of the benefits that we would encounter if we were to expand Medicare to all Tennesseans. First of all, low-income individuals' access to care would increase. Of course, these low-income people would have a larger opportunity to go to hospitals and get the care they really need because they would be it would be available for them. This would kind of increase the requirements, expanding this, so more people would be eligible for it. About 250,000 more people would be eligible for insurance if we were to expand this. Of course, less health insurance companies would be available as well. It would decrease the amount of health insurance companies because they are private companies. It's not really government regulated. So a lot of them would go out of business. It would also reduce the odds of rural hospitals closing because so many people don't have health insurance. They're not visiting these hospitals. Hospitals aren't getting the business they really need because so many Americans aren't going. So now we're facing so many hospitals that could potentially go bankrupt or go out of business because they're just not getting the people coming in. There's no one coming in to get help. So also increasing access to the addiction treatment for low-income individuals as well. They'd be able to go to places for substance abuse. Say if you are addicted, they'd have more accessibility to addiction treatment facilities. They'd be able to get help easier because they can actually pay for it now with an extended insurance. Because before now, if they don't have insurance, these places cost thousands of dollars that they cannot pay out of pocket because they just do not make the income per year. So kind of going into how the economy is affected if we were to expand Medicaid, TennCare as well. It would create new jobs for citizens. It would actually reduce payday loans. Of course, so many of these low-income people have to go get loans out to pay for these bills, especially the different health bills, hospital bills. Say we're riding an ambulance, that's extremely expensive. People are having to go take out loans day to day just to compensate these bills. And this would decrease so much if we were to have kind of a universal health care for Tennessee, or at least extend TennCare. Also, you would see a reduction in bankruptcy if Medicare was extended as well. You'd also see an increase of credit score of people. Of course, that might be on down the road, but if people are able to not spend so much money on their health bills, they can pay their house bills easier. They can pay other simple bills easier to increase their credit score and to help them throughout life, help them buy the things they need and not worry so much about taking care of their children out of pocket because they don't have insurance. And obviously just providing more help in general to the population who are disabled or so many other things that don't qualify for insurance on a day-to-day basis. So kind of I'm going to list some of the cons to expansion as well, just because these cons can be counteracted, they can be fixed, I would say. So expanding Medicare would cost too much. That's one of the biggest cons with expanding Medicare, was that it would cost too much. But when you think of it in the whole grand scheme of things, yes, maybe it would add a few more taxes to your check each month. Maybe for the normal person, they'd pay a little bit more each week on their payroll checks. But you would be helping so many other people by doing so. Maybe you paying a little bit more each week off your checks would help the next person, because if so many people did that, it would save them so much more money as well. That goes along with it would raise taxes, but like I said before, the minuscule amount that it would raise the taxes would benefit those low-income people in significant ways that we really would never be able to understand. It also created debt for the state, but again, looking at the grand scheme of things, the United States was built on being free and being the land of opportunity. And so many people do not get to live that because they're bound by these bills, health bills, that they just cannot pay every day. And so they miss out on things, they miss out on opportunities, which is not what our country is based on. Which kind of leads into my next slide with the amount of countries that actually do offer universal health care. So many other countries offer universal health care for their people, and it's also, which is crazy because they're third world countries, even some offer universal health care as well. And us, the United States, a first world country, does not offer it. We have people that are homeless and low income people that just cannot afford the health care. And this goes along with my last slide as well. These are all the countries that do offer universal health care in one way or another. And of course, we are not one of them. And us being the land of the free first world country, and we do not offer universal health care, which is crazy. All right. So to conclude, I've gone over how extending Medicare will help in major ways. Parents and children being able to get the help they truly need, especially the children, because their parents not having the insurance, of course their children are not going to either. And this hurts so many children in so many ways. It really does. Of course, they're held back by these outrageous co-pays, by just going to the clinic, the bills they have to pay. A new system would create so many new jobs just based off of really the other states that we have seen expand their Medicare. Like for example, Maine expanded their Medicare, it was a few years ago, and actually they had an 11% increase in new jobs, which is listed in one of my sources, and also a higher credit score as well was lifted after they expanding their Medicare. So we can look at other states and the benefits they're getting from expanding their personal Medicare, and we should do the same thing. So also, like I just reiterated before, the United States was built on a land of the free, of having certain morals that we were raised on, and us having to have and pay these outrageous amounts of health care and all this stuff just does not really align with what we were raised on, what we were built with.